Osteoarthritis, or OA for short, usually starts as an annoying ache felt first thing in the morning, but OA can cascade into a bigger problem if ignored, especially for people with high pain tolerances who keep pushing through the pain. If you know someone who has had a joint replacement, that was likely severe OA at work. But rest assured, surgery is not your only option. There are things that you can do to help improve your joint health before letting it get to that point. Stick around to learn 3 key ways to keeping your joints healthy so you can continue doing the activities that you love. Arthritis has been a hot topic these last few years, which I guess makes sense when 24% of all American adults have it. That's 58.5 million people in the United States alone. I'm sure you're thinking, well, the baby boomers are getting older, so it makes sense for a greater increase in arthritis. But did you know that you can get arthritis at any age? Some people even develop arthritis in their late 20s or early 30s. The people that are at greatest risk of developing OA are individuals who spend a lot of time playing contact sports or sports with large landing forces. This includes football, hockey, and soccer, just to name a few. So if you often joke that you have the body of an 80-year-old, this one's for you. Before we can talk about what to do for OA, I need you to understand the basics of what it is and what causes it. So here is a brief, oversimplified rundown. Timer starts now. Osteoarthritis, or OA, is a type of joint inflammation caused by gradual wear and tear of joint cartilage. A joint is where two bones meet. This generally allows for large ranges of motion. Think your elbow, hips, or knees. And cartilage is a tough, flexible substance that acts as a protective layer on the bone inside of the joint. It helps to reduce friction and improves the cushion of each joint. The joints in our body that are most susceptible to OA are joints that create the most motion, and these joints are called synovial joints. Synovial joints have a special covering called a joint capsule. The joint capsule covers the bone and the inside structures like a snow globe. Inside this snow globe lives a special substance called synovial fluid. Synovial fluid is the key to keeping our joints healthy and happy. Now that you're ready for your first biology exam, why did I tell you all of that? Well, the truth is, just because someone has osteoarthritis doesn't mean that they will suffer from the symptoms of osteoarthritis. In other words, the amount of pain experienced does not always match what we see on X-ray, even if the joint has been declared bone on bone. But how can that be? The secret is in the fluid? Synovial fluid, that is. Synovial fluid is the life source to cartilage. It provides a protective slick layer to the inside of our joints. It also reduces friction and improves the cushion of each joint, just like our healthy cartilage is supposed to. To best fight OA, we need to keep our synovial fluid healthy and happy. So let's look at the top 3 ways to do that. There are 3 main ways we can keep our synovial fluid happy and healthy: movement, nutrition and lifestyle changes, and strengthening. Moving our joints creates a happy, healthy amount of synovial fluid by increasing blood flow to our joints. Cartilage does not have good blood supply compared to the rest of our body and relies on the synovial fluid to send in nutrients and remove cellular waste product. When our joint sits around without enough motion, it becomes gross and stagnant, similar to a pond that doesn't have external flow. I mean, which would you rather drink out of? Gently but frequently moving your achy joints can help fight stiffness, maintain your joint motion, and improve your synovial fluid health. This might be as simple as taking some standing or walking breaks during your day, or doing some chair exercises after you know that you've been sitting for a long period of time. If If you already love exercising, but feel your achy joints creeping in, feel free to add some active recovery days that include low impact activity and strengthen those neglected muscle groups. But increasing our blood flow isn't much of a help if we're not giving our body any positive things to bring to our joints. This includes eating balanced meals, staying hydrated, and increasing our healthy fats, including omega-3s. We know for sure there are a few risk factors that increase your risk of developing OA. These include being overweight, having type 2 diabetes, previous injuries to your joint, partaking in activities that increase the shear stress or compressive forces to your joint, and not strength training. If any of these sound like you, reducing risk factors that you can control can help support joint health and reduce the progression of OA. Strength training is the third most important thing we can do to help keep our joints healthy. Training around your achy joints is important, but it's also important to meet yourself where you are. As a previous athlete, I know better than most how easy it is to push yourself pedal to the metal when you start training again, but that often leaves with you feeling pretty awful the next day. It's important to have slow and steady progressions of pain-free exercises to prevent flare-ups and to allow yourself to be consistent with this new exercise routine you're trying to build. I know that was a lot of information, but knowledge is power. Knowing what causes OA is the first step to improving your chances of managing it. Previous injuries might put you at a higher risk of developing OA, but just because you have OA doesn't mean that you need to have the symptoms of OA. Remember, what we see on X-ray doesn't always match the type of pain that we experience. Movement, nutrition, and lifestyle changes and staying strong are best tools for long-term management of OA. You can do this. To take control of your physical health with research-backed information, click the subscribe and follow buttons below.